a good day to you. This is TDT Live. I am Stacey Ann Providence. The Ministry of Health is giving an update on the status of COVID-19 in Trinidad and Tobago, and we're bringing you live coverage on TDT, Talk City 91.1 FM, Suite 100.1 FM, Next 99.1 FM, and on Facebook at TDT Live Online. We go now to the Senior Corporate Communications Officer at the Ministry of Health, Al Alexander.
Good morning, Trinidad and Tobago. Welcome to the Ministry of Health National COVID-19 Update for Wednesday, 11th August 2021. It is a pleasure to be here with you again. Today on our panel, we have the Honorable Terence Dayal Singh, Minister of Health, Dr. Avery Hines, Technical Director, Epidemiology, Ministry of Health, and Dr. Erica Wheeler, PAHO WHO Country Representative. I am Al Alexander, Senior Corporate Communications Officer at the Ministry of Health, and I will moderate this morning's update. Dr. Avery Hines will begin with the latest clinical and epidemiological updates. Dr. Hines.
Thank you, Mr. Alexander. Good morning to the Honourable Minister. Good morning to Dr. Wheeler. Good morning to members of the media, members of the viewing and listening public. The epidemiologic update and clinical update as follows. If I have the first slide. As at the 10th, first slide please. As at the 10th of August 2021, at close of play, 4 p.m., we would have reported 40,574 total positive cases out of 283,910 samples which would have been tested at both public and private facilities. Of those 40,000 plus, 33,539 have already recovered. We currently have 5,891 total active positive cases, and those are distributed as follows. There are 5,284 individuals in home self-isolation, 311 individuals in hospital, and 83 persons in step-down facilities. There are 145 persons in state quarantine facilities at this time. We have also experienced 1,144 deaths, and we extend our condolences to members of those bereaved families. As at yesterday, the laboratory would have reported 213 additional positive cases, and those additional positive cases would have been detected from samples that were collected between the 6th and the 9th of August. As at 4 p.m. yesterday, at close of play, the vaccinations that were delivered would have been 425,422 persons having received a first dose and 242,543 individuals having received a second dose. If we move directly into the next slide, we'll continue straight into the epidemiologic update. We are familiar, I believe, with the epi curve with its many colors, the colors representing different months of the year. The darkest blue over to the right-hand side now representing the month of August thus far. And what we are seeing is that whereas we would have seen the highest numbers of cases in that gold section representing May, going down into June in the blue section, plateauing or basically having the same numbers of cases on average throughout July, and there's a little bit of a rise towards the end of July and into August. So what we're experiencing, what we're describing, is what we are seeing is a little bit of a plateau, maybe a slight increase in the daily number of cases, the daily average number of cases over the last couple of weeks or so. We'll take a look at that at the weekly time scale in the next slide. In the next slide, we see the same data, and it's basically now grouped into weeks, same colors. So July, we saw where there wasn't a large difference between the heights of those individual bars that represent weeks, but we did see that upward trend, and the last 2 weeks showing what we describe as a plateau, basically the same approximate number of cases. Last week, which is the last completed week, we would have found that there was a little decrease compared to the week before it, but nothing that we consider a significant downward trend. And we are currently in the middle of this week, week 32. So this last bar on the right-hand side, where it looks short, does not represent a completed week. And again, this speaks to the plateauing or the relative continual similar numbers of cases that have been showing up week on week over the past 4 to 5 weeks at this point in time. The background of this slide, that orange or peach or salmon color, is the positivity rate. That's the percentage of samples that test positive for COVID out of all the samples tested. And we see that that's been hovering in the low 30s, high 20s, low 30s for the last few weeks as well. So again, not a lot of change in either direction, and this is something that we're keeping an eye on because we are aware that there's several forces at play. There are the forces of additional movement as bits of the economy are opened up, and there are the forces of all of the public health measures in addition to the vaccination. Those public health measures and vaccination help to drive transmission down. Additional movement increases risk of transmission. We're seeing that playing off in the sort of balance that we are experiencing at this point in time. Next slide. This again, the same data now aggregated at a monthly time scale, so you get an overall feel for what's been happening. From May to June to July, we have overall experienced fewer and fewer cases each month to date, and we're now nearly midway through August, so we're approaching the middle of August, and we have good hope that the figures for August may come in lower than those for July, but we really have to see. We really have to continue to look. We have to continue to exhibit caution so that we don't push the numbers higher by moving around unnecessarily and interacting in ways that are not advisable. Next slide, please. We look at the age and the sex distribution of the positives, and we see that it has remained largely as it has been. Right now, it's approximately 50-50 in terms of males and females. Majority of the cases being in that very large age range, 25 to 49, representing the young and mobile and working population largely. And if we move to the fatalities, next slide, we see that the distribution is a bit different, and that the older age groups are more heavily represented up at the top of that pyramid. Male to female ratio now a little under 60-40. It's 57.7% men, 42.3% women. And that ratio has been changing, whereas it was 75% men earlier on. It has changed quite significantly down to 57% males at this point in time, with the majority, more than two-thirds, still being in the over 60 age group, and with the most important bit of information alongside age being that comorbidities, other existing diseases, continue to play a role in the adverse outcomes. Another piece of important information, not represented here, but seen in other presentations, is that at this point in time, we've noted that the vaccination drive has been bearing some fruit. We have not seen any individuals fully vaccinated appearing among the fatalities so far. So that's another bit of good news. Next two slides. So next slide and then skip one. Go ahead, skip. Looking at the geographic distribution now, we see that the numbers of cases in the various communities have been coming down slightly, but there are a couple hot spots in various communities, notably communities in the Caroni and the Victoria counties. And we'll see a little bit more about the trends in those counties in the next slide. Next slide, please. Looking at this, we see that bar chart over to the bottom left represents the changes between week 29 in purple and week 30 in gold. And whereas many of the counties represented show a decrease from week 29 to week 30, we do definitely see over on the right-hand end an increase in County Victoria. County Caroni has had a slight decrease between week 29 and week 30. St. George East was just about the same from one week to the next with a little increase. But this again is demonstrative of the trend. Some going up, some going down, and that balance resulting in approximately the same numbers from week to week. Let's look at that on a weekly time scale. Next slide. The next slide shows us from week 25 to week 30 with the colors representing the different weeks and with the groupings representing the different counties. And we see that whereas there is a downward trend in some counties, Caroni showed a bit of a downward trend, St. Andrew, St. David also, what we are noticing is that there's been a fluctuation in others where some weeks are down and then following weeks are up, followed by a down week, followed by an up week. So again, that lack of a given direction, everyone not going in a downward trend, that is again what's represented by the overall numbers remaining largely the same and sometimes being a little higher from one week to the next. So again, we're just encouraging all people in the population to adhere to the public health measures. They've been simplified into the 3 Ws. You can call it 3.5 Ws now. W, wash your hands. W, wear your mask. W, watch your distance. V, which is half a W, vaccinate. So please follow these guidelines as we hope to drive the downward forces towards preventing or reducing transmission of the COVID-19 virus. With that, I'm going to turn you over to Mr. Alexander.
Thank you very much, Dr. Hines. WWWV, vaccinate. Ladies and gentlemen, PAHO WHO has provided well over 5 decades of quality technical cooperation to Trinidad and Tobago and the region in the field of public health. This support continues even through this current pandemic. I now invite Dr. Wheeler, PAHO WHO country representative, to update us on the status of international vaccinations and Trinidad and Tobago's supply of the vaccines for COVAX. Dr. Wheeler, morning.
Thank you, Mr. Alexander, and good morning. Good morning to you, Minister. Good morning, Dr. Hines. Also, good morning to the viewing and listening public and to the media. And thank you for the opportunity to give this update. I want to start with the first slide, if you can, please, by reviewing the global and the regional picture for COVID-19. So as of the 10th of August, you would see here that we've now reached the hundreds of millions of cases, over 205 million cases of COVID-19 globally, and more than 4 million deaths as well, 4,303,000, over 4 million. But when it comes to the number of doses administered, although we would have wished they'd been higher, it's 4 billion doses, just over 4 billion doses of all of the WHO-approved vaccines, as well as in some countries, others have been administered. In our region here in PAHO, 32 countries have received 35 million plus doses, with a further 346,560 in transit. And as of last night, PAHO has delivered vaccines to 28 countries, totaling over 17 million doses. The reason why there is a slight difference between the amount that the PAHO region has received and what PAHO has delivered is, of course, some other countries have bought vaccines bilaterally, but PAHO has delivered over 17 million vaccines to 28 countries in the region. As you may have seen already on the media, the vaccines, the last tranche of the AstraZeneca COVAX vaccines arrived this morning, 33,600 doses, and doses are arriving today in Guyana as well, and the minister and myself received those doses this morning at the airport. Next slide, please. So I want to talk just a little bit about the issue of emergency use licensing, because I know this has come up time and time again. And I wanted to remind everyone that the vaccines that have been approved by WHO are not trial vaccines. The manufacturers have to apply to a regulatory agency, and the European Medical Agency is the one that we use most in PAHO, but we also take our lead from the FDA in the US. And these agencies are the ones that issue the temporary authorization ahead of the full product license. And why are we doing this? Because we are in the midst of a pandemic. So any public health emergency. And there is a global advisory committee on vaccine safety that ensures quality, safety, and efficacy of all of the vaccines that have received emergency use license. And they receive the same level of scrutiny as the usual licensing process. It is just that it's done on what we call a rolling basis, which means as soon as information comes in and visits are done to manufacturers, then there can be the issuing of the emergency use license based on the actions of the regulators. Next, please. So I won't read all of this, but what I want to say that is really critical here is that there are many strict protections and strong safety and monitoring processes to help ensure that the vaccines are safe and effective. Again, I repeat, COVID-19 vaccines are not trial vaccines. They've been through clinical phases you see there. It starts with animals and then it goes to tens of thousands of people. And it also takes into consideration people who are at high risk of developing illnesses. So therefore, this is why, for example, we talk about persons with NCDs should ensure that they get the COVID-19 vaccines. They are approved by international experts and regulatory bodies. And also very important to note, people say that the vaccines have been approved too quickly and therefore they're not safe. Well, the reason is because there has been an unprecedented financial investment and scientific collaborations between vaccine manufacturers to arrive at where we are today. So some of the steps in the research and the development happened in parallel. They did not wait year after year. So this is why we now have safe, approved vaccines. And they continue to be monitored even when they have been administered at the country level. Next. So what about the emergency use license for the vaccine manufacturers? Now, in addition to the vaccine itself, each new plant, because we have several plants around the world now that produce vaccines, each of them have to have an emergency use license as well. And 6 vaccines that you see here, some of them now have multiple manufacturing sites here in Trinidad and Tobago. We did receive from Korea, from Spain, and from Italy. These are the 3 sources of our vaccines. All have been granted emergency use license, which means that their manufacturing plants have been visited and all of the data that they have provided has been scrutinized and approved. And this has been done by the regulators. And in addition, we have a global strategic advisory group of experts on immunization that recommends the use of only one vaccine at this point in time, the Pfizer-BioNTech in children. And this puts us in a good position now because we will be able to vaccinate children between the ages of 12 and 18. And we continue with the other vaccines to review them for their efficacy for children. Next. Just a reminder about transmission. The more the virus is transmitted, the more we have a chance of generating mutations. Because the more we congregate, the more we don't wear our masks, the more we don't social distance or wash our hands, we will expect variants to emerge. I mean, variants emerge anyway. This is the nature of a virus. It infects the host to survive. And the more we congregate, the more we help it to survive. So preventing transmission is the only way to avoid this super rapid expansion of variants that we are seeing. And all of the control of the public health measures must be maintained alongside vaccination. So we keep saying the 3 W's: wear your mask, watch your distance, wash your hands. But we also need to continue isolation of cases, to quarantine contacts, regardless of which variant is circulating. So you can't say because X or Y variant is circulating, then maybe that's not so bad, we can't continue to observe the public health and social measures. Next, please. Now, I want to just take a moment to address some of the fictitious claims that keep going around. We've addressed these over and over again, but you can never say something too many times, especially when social media has many comments to the contrary. So vaccines are used solely to protect people from diseases. We've had vaccines for a generation. The first smallpox vaccine that was approved back in I believe it was 89 or 98, forgive me, was around long before it received approval. But smallpox has been wiped out of the earth. It was only approved by FDA in August of 2007. So vaccines have been around and they protect people from diseases. Microchips have never ever been used in vaccines and are not part of COVID-19 vaccines. I just explained how vaccines are manufactured and regulated. And vaccines cannot change your DNA. We talked about the messenger RNA, but that does not mean that they change the DNA. It has nothing to do with your DNA. Next, please. The last slide on the fictitious claims is about infertility. The vaccines have never caused infertility, especially we are talking now about those that are under emergency use license. And in fact, that some persons who have received these vaccines as part of the trials have actually become pregnant. So clearly, they do not interfere with fertility. And rumors about the composition, what's in it, whether they be harmful, not just microchips or anything else, these are false. Then now I showed you how many billions of vaccines have been given. Over 4 billion vaccines have been administered globally. So all of the components are always checked during the 3 phases of clinical trials to ensure safety of vaccines. So they are safe for humans. Okay, I just want to end really by appealing to you that vaccines, all of the vaccines that have been approved by WHO, they are our best hope for bringing the pandemic under control, along with the public health and social measures that I have just mentioned. Wash your hands, keep your distance, wear your mask. When indoors, should be in a properly ventilated situation. Testing, contact tracing are still important. And in Trinidad and Tobago, we are very fortunate to have a variety of vaccines that are freely available to the public and approved by WHO. So I want to urge you, in fact, I want to appeal to you from the bottom of my heart, having been in public health over 30 years, get vaccinated and protect yourself and your loved ones. Thank you very much.
Thank you very much, Dr. Wheeler. I now hand you over to Minister Dayal Singh to provide an update on the progress of the national vaccination rollout and the plans for the COVAX batch of vaccines. Minister.
Thank you very much, Al. Good morning to Dr. Hines. Good morning to Dr. Wheeler. Good morning to ladies and gentlemen of the media and all you wonderful people who are listening and viewing on the different platforms. Good morning. So let me bring you up to date on where we are with the national vaccine rollout that entered a new phase on Monday with the distribution of the AstraZeneca vaccines that we got as a gift from the people of Canada. And we want to thank the High Commissioner of Canada to Trinidad and Tobago, His Excellency Kumar Gupta. Thank my colleague in the Ministry of Foreign and CARICOM Affairs, the Honorable Amy Brown, and also the Honorable Prime Minister, who has been at the helm of all of these negotiations. Let me contextualize where we are now. We would have indicated that in early July, mid to early July, we were averaging about 15,000 doses a day. Then by the end of July, we had dropped to about 8,000 doses a day. And then in early August, we had dropped to about 4,005 doses per day. Those were first doses. With the addition of the AstraZeneca vaccines to the national plan from Monday, the figures go like this. On Monday, number of first shots administered was 7,050. So you saw a bump up by about 50%. Interestingly, when we disaggregate the figures, 2,915 were Sinopharm, so that is good, and 4,135 were AstraZeneca. So on Monday the 9th, which was the first day where we had a choice of vaccines, AstraZeneca and Sinopharm, we gave out 7,050 combined. Yesterday, being the second day of this program, we would have administered 7,384 first doses. disaggregated as follows: 2,316 Sinopharm and 5,068 AstraZeneca. That gives you a grand total of persons with first doses to date, 432,806 persons, which represents roughly 31% of the population. Now, for members of the public who want to access the Sinopharm vaccine, and when I go out and I speak to people, there are still a large number of persons who prefer the Sinopharm vaccines. Those are available at all 109 health centers throughout the country. It is also available through our drive-through vaccination sites. As promised, we have started distributing it in places of worship, community outreaches, and so on. So it's widely available. It's within walking distance, a short drop, a little taxi ride, and so on. And the AstraZeneca first doses are available at our mass vaccination sites. 9 in Trinidad and Tobago will have their own rollout. So it's convenient. It's there. Don't wait for a crisis to become vaccinated. Don't wait until you hear something in the media that panics you into being vaccinated and you rush to the sites. Just go to the sites. For the first dose AstraZeneca, we do prefer appointments. You can easily make your appointments to the call center or the online. Although we will not turn you back if you walk in, what is happening at the mass vac sites is that many people with appointments are coming very early for the appointments and then bouncing up with those who are walking in and creating a bit of a crowd. So those with appointments, turn up about 15 minutes before your appointment. What is happening? People are coming 2 hours before, 3 hours before, and it is giving us a bit of a logistical problem to manage the crowd. So just come maybe 15 minutes, half an hour before your appointments. But we do urge, as far as possible, if you want to access the AstraZeneca vaccines, we do urge you to make an appointment. It will be so much easier on yourself and on us who have to manage these sites. So that's the data on first doses. Data on second doses. On Monday 9th, we would have administered 12,083 Sinopharm second doses and 919 AstraZeneca second doses for a total of 13,002. Yesterday, we would have administered 11,946 second doses for Sinopharm and 649 AstraZeneca second doses, to give you a total yesterday of 12,595 second doses. That part of our population now, which that part which will have 2 doses, is now 255,138. So what does that mean for those persons who now have 2 doses, and for those who recently got it 2 weeks ago? Within 2 weeks, you will be considered fully vaccinated. I want to echo what both Dr. Hines and Dr. Wheeler has said. It means those 255,138 persons, that roughly 250,000 people, they stand little or no chance of getting serious COVID disease. They stand little or no chance from dying from the disease, and they stand little or no chance of getting into ICU or HDU. So those 255,138 persons, once 2 weeks has passed after your second shot and you are considered to be fully vaccinated, you are amongst that group of persons who stand a 99% chance of not dying from the virus, not getting seriously ill, or not finding yourself in an ICU or HDU. And I want to congratulate and thank them. And when we visit these sites, we always talk to them in their hundreds to spread the word on the ground to get vaccinated. As Dr. Wheeler has said, and as you would have seen in the media this morning, we received another 33,800 doses of Sinopharm vaccines this morning. The lion's share of that will now go into the system to join the Canadian donation. We have to hold back about 7,000 or 8,000 and reserve that for people who have to get their second dose, who would have received their first dose about 6 to 8 weeks ago. So 33,000 minus about 7,000, that leaves about 26,000 doses. It's a two-shot regime. Divided by 2, it means now, with AstraZeneca, we could pump another 13,000 into the system to add to the roughly 40,000 that we pumped into the system from the donation of Canada. So it means the MassVac sites that are currently administering the AstraZeneca first dose will have an additional boost. So we now have some choice across the board. Sinopharm, available at all your health centers. Just walk, go, get it. It's available in drive-thrus. It's available in our outreach programs, in churches, temples, mosques, community centers. And I want to thank all the MPs. I myself will be doing a drive at the Mount Lambert Community Center, Mount Hope Community Center on Saturday. This is in addition to about 300 persons from the constituency of St. Joseph that we have had vaccinated to date. So all MPs, I want to thank them from both sides of the political fence, because this is totally non-political. Thank all councillors, thank all religious leaders who are influencing gently and giving people the information they need and leading them to a place where they can make an informed decision to save their lives, protect their families, and most importantly, protect those who cannot be vaccinated at this point in time. So Al, that is the vaccine update to date. Thank you very much.
And thank you, Minister. Now, last week, we introduced a new segment to these COVID-19 updates called You Speak. On You Speak, we reach out to you, the public, to hear your concerns and have members of our panel answer your questions. So without further ado, let's hear You Speak.
Hi, I'm Natasha from Next 99.1 FM. Last week, the Ministry of Health went into downtown Port of Spain to hear from you. This week, we're at the famous Daybase spot to answer your questions and respond to your concerns about the COVID-19 vaccine.
So the question I have is, how often do you have to get more doses for the Sinopharm if you already got your 2 shots? Do you have to in the future?
Just repeat the question.
So just ask, should we repeat the question? The question was, will you need COVID-19 booster shots after taking the vaccine? Dr. Wheeler?
Well, thank you, viewer, for that important question. I do believe many people are asking this question, but at this point in time, there is actually no proof that a booster vaccine is required because we don't yet know how long protection lasts. I am aware that booster vaccines are being offered in some parts of the world, but it is far more important that the majority of persons in any country gets vaccinated. That's the best way to protect them from contracting COVID-19. I just want to give you just a little bit of information here. In a study in Israel, it shows that although there's been a very slight decrease in the effectiveness against infection, but for example, the Pfizer-BioNTech vaccine is 93% effective in preventing serious illness and hospitalization. In a British study, there's a similar result with over 88% protection against symptomatic disease, but over 90% protection against being hospitalized or dying from contracting COVID-19. So the 2 vaccines we have in Trinidad and Tobago, but all of the vaccines that have been approved by WHO have been shown to provide excellent, not just good, but excellent protection from severe disease, hospitalization, and death, including against the current variants of concern, like the Delta variant. Thank you.
Okay, so my question is that the ministry has made it compulsory for food handlers or anybody in food sector that we must have both vaccines taken. And my question is, why do we have to get it? Because you can still transmit the disease, and I want to know why it is, if we are transmitting the diseases, whether we have the vaccine or not, that you are making it compulsory for us. You are taking away our rights. Why do you want us so badly to get the vaccine? Right? That's my question, and that's a question that has been bothering a lot of people, because a lot of people don't want to get the vaccine at all because of health risk. And I agree, because I have a 5-year-old and I need those questions answered.
Thank you very much. So this is a policy question which I will take. And I am so grateful that she identifies herself as a food vendor. So let me make it clear. The Ministry of Health has made no such declaration that vaccines are compulsory. That is a rumor, again, that has been going around. The COVID-19 vaccine, like all vaccines in Trinidad and Tobago, are voluntary. So I hope my friend in Davie hears that, and everybody else who has this question. The COVID-19 vaccine, the Ministry of Health has not made it mandatory. However, we are not taking away anybody's rights. It is your right to refuse to be vaccinated. However, that vendor made a very important point. She spoke about her 5-year-old child. And this is what we keep saying. That 5-year-old child cannot be vaccinated because as yet, as we speak now, there is no vaccine, and Dr. Wheeler could correct me if I'm wrong, that has been WHO approved for 5-year-olds. So they can't be vaccinated. Therefore, it is important for the household to be vaccinated to prevent your child from getting ill. And it's not only to prevent the child from getting ill. Dr. Surjit Singh was here on Monday speaking about the first mother-to-child transmission of COVID and the first maternal death. That's another group that cannot be vaccinated at this point in time. That may change. So it is so important for households that have children under 18 and pregnant persons who at this time cannot be vaccinated, that everybody else becomes vaccinated to protect them. So I'm really grateful for that question. It's a burning question, and let me just reiterate, the COVID-19 vaccine is voluntary. No one is taking away your rights. You have the right to refuse it, but it is highly recommended. Thank you very much, Al.
Thank you.
Hi, I want to know how safe the Sinopharm vaccine is.
Okay, thank you. How safe is the Sinopharm vaccine? That was the question. Now, the Sinopharm vaccine is probably one of the safest of the vaccines that's on the market at the present time, and it is because it is one of the vaccines using a tried and true, well-established platform for vaccination, meaning the way the vaccine is made. They take an inactivated virus and they treat it in such a way that it cannot replicate, and then they give that to you so your immune system can recognize it. This technology has been used for decades and has been proven to have a very good safety profile. The Sinopharm vaccine has the least reports of even the systemic side effects, like the fever or the fatigue or the injection site pain, etc. And there haven't been any reports of serious adverse events that are actually associated with the Sinopharm vaccine to date. We continue to collect data, but so far, one of the oldest platforms, best safety profile there. Definitely one of the vaccines that people have reported the least side effects on. and they haven't had any severe or serious adverse effects or adverse events associated with the vaccine. And of course, it works. It works well. So it does reduce your risk of getting ill, reduce your risk of getting into the ICU, or reduce your risk of serious illness and death. And just to correct a misconception, the vaccines reduce your risk of transmitting illness. So it's not that whether you get the vaccine or not, you transmit illness in the same way. If you don't get the vaccine, you're much more likely to transmit illness. If you get the vaccine, you are less likely. So it's not that it's equivalent and therefore you can take it or don't take it and it makes no difference. It makes a difference, and that's why we advocate for the vaccines to be taken. So thank you for the question.
So you asked and we answered. Look out for us, coming to a location near you soon. Till then, remember the 3 W's. Wash your hands, watch your distance, and wear your mask.
We thank the public for posing these very important questions, and of course our panelists for providing those responses. I invite you to address your COVID-19 questions to us, and look out for the You Speak team, which may be coming to your area very soon. Now, we once again remind our media representatives. Of course, we'll be going to the media section now, and we want to remind our representatives to state your name and the name of the media house that you represent before asking the allocated 2 brief questions. Please ask both questions, one right after the other, to the relevant members of the panel. If time permits, as you know, we will facilitate a second round of questions, 1 question per media house. Today, we begin the question and answer segment with Guardian Media Limited. Good morning.
Hi, morning everyone. Rashad Khan, Guardian Media Limited. Okay, so both my questions this morning are for the Minister of Health. So firstly, Minister, now that there is essentially a choice of vaccines, what systems are in place to prevent someone from getting one vaccine, so Sinopharm being fully vaccinated and just going and saying they didn't or whatever, however they want to, and get another vaccine and an update on those fraudulent immunization cards you'd have mentioned before? And my second question is, a report came out that we expect some Pfizer vaccines have been allocated to the country from the US. So I just want an update on that. When do we expect it to come? And are we planning on ordering more doses from COVAX? Thank you.
So thank you very much, Rashad, for your questions. So on the issue of the fake cards, as you know, that matter is with the police service. We sent another one on Monday of this week, where we got some more, where we have good details now. We actually have the person who actually wrote the card. So that has been sent to the police, thanks to the whistleblower who came out and let the police investigation take place. And hopefully that person could be facing 7 years in jail. We take this, Rashad, very, very seriously. The issue of persons accessing multiple vaccines, we have put in place at the sites that are distributing the AstraZeneca. I wouldn't say foolproof, no system is foolproof, but we do have electronic records and the manual records, so that if we suspect someone is trying to get another vaccine, there are ways to check it, but as you know, no system is actually foolproof. On the issue of the Pfizer vaccines, let's wait for the Ministry of Foreign and CARICOM Affairs, maybe together with the White House or the State Department, to make a formal announcement. I, just like you, saw that report from the Washington Post, but I have no formal information right now to share with you to say yay or nay. Okay, on Pfizer. Thank you very much.
Thank you, Minister. We quickly go to AZP. Good morning.
Hi, good morning. Private Harry, AZPnews.com. My question is for Dr. Hines. Dr. Hines, some people are concerned about when they get a quarantine orders, they wait 14 days and they don't get any more information about whether they can leave their homes etc. Can you give some advice? Do they have to wait another, get another order in order to leave their home? And my second question, Minister, in terms of herd immunity now, what figure are we looking at now? Thank you very much.
Okay, thank you for the question, Mr. Bihari. Usually what happens with the quarantine orders when they're written is they are written with an expiration time, so that you are given a time frame beginning at date X. So if you have a 14-day quarantine order that is signed today, it will say that you are instructed to quarantine for 14 days beginning on August the 11th. And at the end of that time period, once that time has expired, then the quarantine order has expired. Now, in terms of leaving your home, clearly you would expect that someone under a quarantine order would not leave their home until such time as that order has expired. But generally, I think that the way that the orders are written is that you don't need to go back and then get a quarantine release, although in some cases, earlier they may have written the orders slightly differently. I believe that they now they contain the expiration dates within them. So that hopefully clarifies.
Okay, and I will take the second question. Thank you, Prior. So you were asked about what it means for herd immunity percentage-wise. So the concept of herd immunity for COVID-19 has always been, to date, 60 to 70% of the population. That's correct?
Yes.
Yeah. Right now, as I gave the figures earlier, persons with second dose, 255,138 is roughly 18% of the population. However, 432,806, which is 31% of the population, currently have their first dose. And hopefully, the vast majority will transition to their second dose. So we could look forward to about 30% of the population being fully vaccinated once those 432,000 persons transition from first dose to second dose. What we have seen in the past 2 days, over last week, when we were at 4,500 first doses, we have gone up to 7,000, 7,003. Prior, in doing some rough calculations last night, if we can get 14 days, 14 vaccination days, of a minimum of 10,000 first shots a day, that will give us 140,000 more persons to add to the 432,000. That will take you up to 572,000. Just a little bit shy of what I was hoping for was 600,000. But if we get 14 good days at a minimum of 10,000 and we reach 572,000, that takes you to 40% of your population. And then we have to try to get up now to add another 20% to take you up to 60% of your population, which is considered to be in the realm of herd immunity. So that is what we are looking at. What are we doing to reach there, Prior? Communications, communications, communications. Choice, 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 and reach. The vaccines are free. The vaccines are free. They are literally available to you within walking distance of close to 130 sites throughout a small country like Trinidad and Tobago. So we continue to dialogue with persons. We are answering your questions from Debe, from Port of Spain. You have companies now doing the ground war within their employee base, talking to them, building confidence. We are trying to replace fear and rumor with information, so more and more persons can make the right choice, and the right choice is to be vaccinated. And let me reiterate for my friend in Debe, the Ministry of Health has never made or suggested that vaccines are mandatory, but they are highly, highly recommended. Thank you very much, Prior.
Thank you, Minister. We now go to 98.1. We are ready for your questions. Good morning.
And good morning to you, Mr. Alexander, and good morning to the panel, Minister Dayal Singh Dr. Hines and Dr. Wheeler. Stephen Cummings, 98.1 FM. My two questions, one for Dr. Hines and the other for Minister Dayal Singh. I first start with Dr. Hines. Dr. Hines, I got a question from one of my listeners in one of my programs. And the question is, what medical advice can be given regarding vaccination to someone who has just turned 18, being the legal age of adulthood? Is it safe to vaccinate having just turned 18? So that's a question to you, Dr. Hines. And Minister, many unanswered questions remain on the policy for the reopening of schools, which some say could be a super spreader event. And I focus on some teachers who may be in the anti-vax camp. How is the ministry going to treat with an unvaccinated educator, for example, who functions in such a populated school environment? And I hear the voices as well of tutor also calling for a clearer reopening plan for schools. Minister.
So I'll take the second question first about schools. I would suggest, Mr. Cummins, thank you for your question. I think they are topical about schools. But I think anything to do with the policy position for reopening of schools should be placed or directed to the Ministry of Education and or the Minister of Education. We at the Ministry of Health, as we have always done, will supply technical advice and technical support. But the Ministry of Education will be in charge and responsible for developing the policy and articulating the policy. So that's the direction in which I can steer you, Mr. Cummins.
Okay, thank you for your interesting question on the birthday and the just turning 18. Now, the two things at play, one is a policy and one is a biological concern. From a biological perspective, day one being yesterday 17, today you're 18, there's no huge biological difference. However, from a policy perspective, the vaccinations at this point that have been approved for individuals 18 years and over. So once the calculation from your date of birth to today's date is 18 years or more, then yes, you can go ahead and get your vaccine.
And let me just support the policy part. We must only vaccinate persons 18 and over to prevent lawsuits, because the vaccines are approved for persons 18. Policy has to reflect that. If you vaccinate someone 17 years and 364 days, and that person unfortunately has a massive adverse event or dies, maybe not even from the vaccine, but even attributable to some way, you open up the country and the taxpayer to a lot of legal ramifications. So it's biological, it's policy, but it's also legal. So Mr. Cummins, I think you asked a very, very important question there, and I hope it brings some clarity to the issue.
Thank you, Minister. And Dr. Hines, we go to IETV for your two questions. Good morning.
Hi, good morning, everyone. Pinama here from ITV News. I have two quick questions, please. My first questions would go to Minister Dayal Singh. Minister, are doctors and nurses trained and prepared for the Delta variant? I know right now the focus is on vaccinations, but earlier on we would have spoken to the Nursing Association, and they said that a number of nurses have limited training in terms of specializing in ICU, for example. So are the doctors and nurses trained and prepared should we have an outbreak? And my second question, I don't know if Dr. Hines will be able to assist. Can we have an update on the testing and test results? Because we know for a number of patients, they have been waiting for about 2 weeks for test results once tested at a public facility. Thank you.
Thank you very much, Bina. So I'll take the first question about training. So we would have met the Ministry of Health, a month ago. Dr. Wheeler, you were there. We had a roundtable discussion with CARFA, WHO, PAHO, the Ministry of Health, and all 5 RHAs to start to ramp up and plan for the inevitable discovery of the Delta virus in Trinidad and Tobago. At that point, we identified various touch points. 1, the A&E response to boost that. 2, the ICU response to boost that. You would have seen that Dr. Richards was given a mandate by me directly to increase our ICU capacity by 100% in Trinidad and Tobago. We trained over 150 nurses, Trinidadians and Tobagonians, in ICU management last year. We also brought in last year 12 Cuban nurses, ICU nurses, and 30 more this year. However, Bina, as I said yesterday when the Admiral Fowler was here, and we keep saying it, a bed is not a bed. A bed needs people around it. And there may come a time if the unvaccinated population, if the Delta variant gets hold of them and flood our hospital system, no matter how much physical capacity you put there aren't multiples of 100%, 200% of additional nurses and doctors and everything else. It does not exist anywhere in the world. And you are seeing hospitals, I don't want to call the countries, near and far, that are now buckling with 150%, 160% capacity because of Delta variant. Countries near and far. Because people are now unvaccinated. So I know all health policy advisors around the world. Whenever you hear them on CNN, BBC, Al Jazeera, Euronews, wherever you hear them speak, they all say now they are beginning to sound like stock records. There was a recording recently released by Dr. Brobrun, the Chief Medical Officer of St. Lucia. Now, for a Chief Medical Officer to put out what she said, where she is fed up, where she's absolutely fed up with certain things and appealing to people to be vaccinated. So the answer to your question, Bina, is not necessarily more ICU, more nurses, more doctors, more training, because that is finite, that is limited. What is unlimited now is the access to vaccinations. And the solution right now, as opposed to 3 months ago, is vaccinations. Don't wait. I'm asking the public, don't wait for the advent of some variant that you are now scared about to then rush to the sites to be vaccinated. We have been talking about the inevitable discovery of the Delta variant for over a month now. Get vaccinated. Get vaccinated. That is where we are right now, Bina. So thank you for that very important question.
Dr. Hines?
Okay, now I am not aware that there is currently any lengthy delay in getting results across the board from the testing to the tested. So if there are incidences in which this is occurring, then perhaps those individuals would want to reach out directly to the county medical offices of health, or they can reach out through the hotline. The general turnaround time for receipt of results has been relatively short. As far as I'm aware, I think the results get back to individuals within 4 to 5 days. The testing plus the turnaround to get back to the site where the test was performed and be disseminated shouldn't usually take longer than that. So if there is an issue, perhaps you can even relate that issue through the comms department so that we can look into it further. But it doesn't appear, as far as we are aware, to be a widespread thing at this point in time. So thank you for noting it. If you want to share more information, please do so through comms. And those who are awaiting their testing can either call directly to the county medical offices of health or to the hotline.
Let me just go back to Bina's question a sec about nurses and doctors and training. As I said, you could train as much as you want. The nursing pool is finite. The doctor's pool is finite. But we are again appealing, and I've been working with the president of TTRNA, Mr. Eddie Stewart. The vaccination rate amongst our nursing staff continues to be of concern. In meeting with the CEOs of the RHAs yesterday, we continue to reach out to them literally one by one. They have informed me that their estimation is that about 50% of our nursing pool have been vaccinated. Nurses make up about 6,600 persons, so it means we want to vaccinate as many nurses as possible. Why? Because we love you. We want to see you around. 2, we don't want any healthcare worker to fall prey to COVID-19 or the Delta variant. We don't want you to pick it up from a patient. We don't want you to give it to a patient. We don't want you to take it into your communities where you live, your households, public transport. So whilst at the level of the doctors, the physicians, it is over 90%, we still ask nurses to do the necessary research, work with us, and get vaccinated. Now you have a choice between Sinopharm and AstraZeneca. So thanks for allowing me to make that appeal to our nursing staff. Again, we love you all, and we want you to be safe.
Thank you, Minister. We now go to Power 102. We're ready for your 2 questions. Power 102, good morning.
Good afternoon, Sparkle McIntosh, Power 102 Digital. My first question is for Dr. Hines. Dr. Hines, can you provide a comparison of testing numbers for the months of May, June, and July across Trinidad and Tobago and the positivity rate for those 3 months? My second question is for Minister Dialsingh. Minister, is the ministry now considering that the slowdown in vaccinations within the last 2 weeks has significantly been a Sinopharm brand issue? And this is since a lot of people have been flocking towards taking the AstraZeneca vaccine. If this is the case, what is the ministry planning to do to deal with this situation? Thank you.
Okay, so I wonder if we can pull back up that weekly or monthly slide. I think it's slide 3 or 4 in my slide set, please and thank you. While we speak about that, while I don't have the exact numbers of tests for May, June, or July, the positivity has been reflected in that slide set at every. So next slide, and the next one. Next. If you look at thank you. If you look at that salmon section at the back of this graph, you see that the height of that salmon peak near the month of May was above 40%, and that was what we were concerned about. That was where we were at the height of the third wave, and we had 45 out of every 100 tests that were being done coming back as positive for COVID-19. In June, that dropped, and in July, it dropped further, but not by as much, so that we're now hovering in the low 30s, high 20s, a lot of the time with respect to the actual positivity number of cases that come back positive from each 100 tests that we perform. So while the numbers are actually driven by how many people present themselves to the health facilities, to the health system in order to be tested, and as transmission goes down and levels of respiratory illness in the population decrease, you may see an overall decrease in number of people presenting for testing. This positivity rate, which is now a proportion thing, it's a proportion of those who have been tested who come back positive. This is a reasonably good indicator of trend, and what we're seeing is that trend has actually flattened out between last month and this month. And again, what we want is a downward trend in both number of positives and the proportion of positives to indicate that we're having less and less virus in the population. So at this point, what we're having is a plateau, both in terms of numbers and in terms of positivity. And again, the important thing here is to drive the public health measures that will reduce transmission, and the vaccination, which will also help to reduce transmission, as well as the more serious outcomes. So thank you for the question.
So, Sparkle, to answer your question, I think the answer could be found in an earlier answer I gave. We are focusing on communications, choice, and reach. So I'll repeat again. So the Ministry of Health is engaging in robust communications, as you have seen. The RHAs are running their ground campaigns on the ground, literally door to door. You will see the private sector also doing their own ground campaign with employees. We are dialoguing. We are answering questions, answering concerns. We are trying to replace fear with information. We are trying to build confidence, and this is the best practice we are seeing around the world. Without forcing people, without preaching to them, it's about persuasion, encouraging. We are giving them more choice now. So you have AstraZeneca and Sinopharm and Reach. As I said earlier, we're making it convenient. We're making it easy. 109 health centers, 9 mass vac sites in Trinidad, 1 in Tobago, 4 drive-thrus, 3 in Trinidad, 1 in Tobago. We are going to places of worship, outreach in community centers. Vaccines are now available literally within walking distance or a short drop. We have it at Sentinel Physicians, private hospitals. So it's convenient, it's available, it's accessible. So it's a 3-pound approach: communications, choice, reach, and convenience. Thank you very much, Sparkle, again.
Thank you very much, Minister. And I know you also mentioned earlier that it's free.
And it's free.
Yes.
Yes, it's free.
Okay, we now go to 103.1 FM. You ready for your questions?
Hi, good morning to everyone, or good afternoon to everyone, as a matter of fact. My first question is premised on the reports that some Pfizer doses are on its way to TNT. I know Minister would have addressed it before, but I'm going to pose a question as it's not directly related to the arrival of the vaccines. There have been reports out of England about extremely rare occurrences of heart inflammation, noted more frequently after second dose Pfizer in young persons. The JCVI has guidelines for children and other at-risk groups, but they are saying and they are advising that only a first dose should be given to those 16 and 17 years old outside of those at-risk groups, with a second dose only to be offered pending further evidence on the effectiveness of the vaccine. Can the ministry address this particular matter in the event, of course, that the Pfizer doses do in fact reach TNT? My second question has to do with reinfection. Do we have a figure for how many people may have been reinfected with COVID-19 and even how many times they may have been reinfected? Taking these numbers into consideration, what can you say about natural immunity in TNT at this point? Natural immunity is a topic that I've heard come up quite often in the public domain. Those are my two questions. Thank you very much.
So I will take the first question about Pfizer and what you have seen coming out of England. Dr. Hines was asked a similar question on Monday, and I remember his response. We have to be very careful how we repeat, use, and disseminate information which has not been thoroughly peer-reviewed and thoroughly analyzed. Our position in Trinidad and Tobago has always been for better, that we rely on robust scientific evidence from WHO. Whilst data and research from individual countries is always useful and not to be discounted, that information has to be peer-reviewed, has to be authenticated, and has to be robustly audited and examined. And we will never knowingly put any medical product or device into the public domain that we know is either unsafe or unsuitable. So rest assured, whatever vaccine we offer the population, for any subpopulation, whether it's pregnant women, children, or whatever, we will depend not only on WHO, not only on PAHO, not only on CARFA, but our local TAG group, Technical Advisory Group, led by the Chief Medical Officer, to make sure what we do is safe for our population. I don't know if Dr. Hines has any information on the second question.
Okay, so thank you for the second question. Now, one of the things that people may not realize is that the question of reinfection is not that simple. If you have someone who was tested before, tested positive, and then tests again and tests positive, several things fall into the mix with regard to whether this is a reinfection, a prolonged infection, prolonged shedding of virus from an old infection, etc. So whereas we may sometimes see individuals pop up within a relatively short time frame with more than one positive, those aren't necessarily counted as reinfections, especially if it's a short time frame. And if it's a longer time frame, more information is needed on whether there is an immune issue, whether there's a documented long COVID issue, lots of things before you can say this is a reinfection as opposed to a prolonged positivity within the individual's system. Now, the second question, or the second part of that question with respect to natural immunity, what we have seen, this is the international literature now, is that whereas natural immunity may vary in its duration and its robustness over a given time frame, and we've only had a year and a bit of follow-up to be able to compare natural with vaccine-based immunity, one of the things that they've noted is that the vaccinations give a robust and a long-lasting immune response and a long-lasting or longer-lasting immunity in some cases than that natural exposure. And that may be because of the dose of virus that you would have been exposed to. It may be for a range of things, but with a vaccination, it's a standardized exposure. And those standardized exposures have, in fact, generated good and long-lasting immune responses. So vaccine immunity is considered to be superior to that natural quote-unquote immunity, although, of course, there is some level of natural immunity that will follow any infection for some period of time. Research is ongoing, as it is a relatively new virus, to see exactly how long such natural immunity will actually last. I hope that helps to clarify to some extent.
Thanks a lot, Dr. Hines. Our last reporter, TV6, we're ready for your questions. Good afternoon.
Good afternoon, Renessa Cutting, TV6 News. Both of my questions are for the Minister. Firstly, you would have indicated that the investigation into the fraudulent vaccinations is still ongoing, but any further information you could provide us at this time, such as, is this person of interest a medical practitioner? Was this activity taking place in any particular geographic location, or any other information that you have? And my second question is, could we have the expiry dates for the vaccines that we have in hand at this time, given that the uptake is not where we expected it to be or hoped that it would be, so that we can have a sense of whether we may end up with any vaccines on our hands that may expire? Thank you.
Thank you, Renessa. So I will take those questions. So as regards of giving out information, Renessa, I think both you and I want to see a successful prosecution. It will be irresponsible of me to give out details on an ongoing police investigation, which will jeopardize that successful investigation and hopefully prosecution. So because of that, I think you and I want the same objective. We want these persons to be prosecuted to the full extent of the law and to spend 7 years in jail. So you will have to forgive me for not giving out information. 2, expiry dates. So Sinopharm is expiring in June 2023. The I'm talking from memory now because I remember saying it on Saturday or Monday. The Canadian donation, 31,000, is expiring at the end of August, which we are using now. And of that, we have used to date, let me get it here, 5. So we have used 9,000 up until yesterday of that 31,000. So we have roughly about 20,000 to use again. All things being equal, we will finish that way before the end of August. The balance of the Canadian donation is expiring at the end of October, which is about 50,000 around there. Nicely with 8 to 12 week window. As a matter of fact, we'll be dipping into that later expiry date for this first round because we anticipate we'll use out all of the batch expiring at the end of August. So there's very little chance of those expiring. And the batch that came in this morning, Dr. Wheeler, November, I believe it is, expiring at the end of November. So as far as expiry dates are concerned, I think we're in a pretty comfortable position where we can use out all of these within the expiry date window. Thank you very much, Vanessa.
Ladies and gentlemen, we have come to the end of today's media conference. Yes, we went a little over, but it was really to facilitate the questions, very important questions that would have come from the media, and we thank you for them. Please remember that COVID-19 vaccine is an essential ammunition in this global fight against COVID-19, and vaccinations will allow Trinidad and Tobago to move from managing the virus to controlling the virus. Vaccinations continue to be the world's response to health threats, as vaccines protect against severity of disease and death. And even if you are vaccinated, you should still follow the 3 W's: wash your hands, watch your distance, wear your mask, and the half W, which is the V, vaccinate. Thank you very much, and goodbye for now.